Okay, and this is the Social Service Committee meeting. First order of business is approval of the minutes. Second? Moved and seconded. Okay. Current business, authorization for the submission of a grant application to the Capital Region Economic Development Council regarding building renovations at the nursing home.
Thank you, Mr. Chairman. Larry Slacky could not be with us this evening, so I'm sitting in somewhat on his behalf. Again, looking to submit yet another CFA application to do these modifications very preliminarily to the nursing home.
Any questions, discussion?
I'll make a motion.
Second? Moved and seconded. Any objections?
Thank you.
Okay, thank you. Next order of business, authorizing an agreement with the Island Peer Review Organization, Inc. regarding auditing services pertaining to the Medicaid fraud, waste, and abuse control activities.
Yes, good evening. I'm Michelle McClave, Executive Deputy Commissioner at DSS, and this is John Watterson, fraud investigator with DSS. We respectfully request approval for renewing a contract, the second year of a 4-year contract with Island Peer Review Organization to conduct Medicaid investigations of potential Medicaid fraud of providers to determine if overpayments, fraud, or abuse has occurred. This is a $166,000 contract. There's 0 county share for this contract, 50% federal and 50% state reimbursement for these services that are requested by the Office of the Medicaid Inspector General. They request that we provide these services.
And this is the second year of a 4-year, right? But
Yes.
this is the same basic contract that we've been doing for the last 4 years and then the
Multiple.
4 years before that, right? Okay.
Correct.
Given that, can you give us any updates on what monies we've recouped from some of the audits?
Yeah, I've got it.
Oh, that's what this is? Great. Can't read it.
I need bigger bifocals.
Thank you.
Can you, maybe you can give us a brief summary of what's been
Yeah,
happening?
when looking at the last 5 years, we have spent, I think we've reimbursed iPro only $138,000, but we've recouped over $370,000.
Denied.
All right, just be fair, because I haven't looked at this.
Yeah.
Maybe this might answer some of the questions I might have, so I'll take a look at it, and
Sure.
if I have something, I'll get back to you.
Mr. Chairman? Is this a grant where we pay them a flat fee, or do they, like the Medicaid Inspector General does when they go in and audit hospitals for Medicaid, they get a percentage reimbursement based on the amount of fraud that they find?
No. No, iPro doesn't get an increased amount that they
Okay,
find.
so
And
there-
one of the reasons, initially, they thought that, it would be an incentive to be a little, go overboard. So iPro doesn't, they just do the flat rate, the fee for auditing.
I mean, OMIG probably negotiates with the providers. If there's a, large investigation, they may negotiate the reimbursement, but iPro doesn't have a commission, so to speak, on this.
Okay, and is iPro the only vendor to do this, or are there other vendors that OMIG recommends on an approved list?
When we did the RFP last time, there were 2 responses, one from another auditing firm, and all things being equal, they scored lower than iPro, and that's basically why we selected them.
So there wasn't a new selection process, this is a renewal of an existing term from when there was a competitive selection
right.
and 2 people proposed. And how far does this go out?
This is the second of 4 years, so there'll be 3 more years. This is 3 more years.
Okay. Do you know if there are other people in this market that do a similar activity for other municipalities, other counties?
We have checked that out.
Yes, so the other group that did that was the Bonadillo group, which we had actually had used for Medicaid to use with folks who have small businesses. Bonadillo was excellent, iPro was both excellent. I called all the other districts that are involved in the demo project and asked them about iPro and Bonadillo, and basically they all came back, they both were very good auditing companies. In our prior experience with Bonadillo, they were very good also.
Did they also work on the same structure, which was a flat fee structure?
Yes.
And
Yes, they were the only two to respond to the RFP also. One other company just had a light interest and then declined.
Could you just go over the numbers that you quoted orally in the beginning? It's hard to follow them on these. You said there were,
Just the gross numbers
Yeah.
are, in the last 5 years, 138,000 paid out on the contract and 370,000 recouped. And we still have, we have 11 cases right now actively being investigated by iPro at this time.
so for 5 years, it was 138,000 per year, or
No,
cumulative?
total paid. The reason for that is there was a restructuring at OMIG during this time period. So the contract, the reimbursement was a little bit lower because OMIG was basically figuring out what to do in this area. We expect that will increase in the next year or 2 years, because OMIG is now putting another effort forward to look at provider fraud.
So in 1 year, we're proposing to pay them $482,000?
No,
No.
166,000.
Oh, the 482 is the cumulative for the 4 years?
482. I'm not sure what you're saying, 482.
Oh,
What's the
oh,
482?
excuse me. Resolution 1 number, 482,261. Thought it was a dollar figure. I apologize.
The contract is up to 166.
166, okay. So it's 138 to 166.
Well, the 138 was over a 5-year period.
That was an average?
Yeah.
That was the total spent.
That was,
Total
what
spent.
was it last year?
Last year, for 2015, for iPro, we spent $12,475.
Right. But previous years, we were spending the 166,000.
No,
Yeah.
Any other questions, comments, observations? Could I get a motion? Second. All those in favor? Any opposed? Passes.
Thank you.
Thank you.
Authorizing an agreement regarding the weatherization assistance program and amending the 2016 Colonel Cooperative Extension Budget.
Yes, good afternoon.
Aye.
I'm Butch Lawyer. I'm actually retired from Cooperative Extension. I came in today to bring my replacement in, John Kerrigan. Good afternoon. We've been running the weatherization program for the county here since 1980. We just got about $41,751 increase, a little bit more money from HEAP and DOE came through. So we're just asking to accept a little more money this year. And we're going to do about 4 or 5 more units with that cash.
Any questions?
I'll make a motion.
Second. Move in second. All those in favor? Any opposed?
Thank you. Thank you. This is definitely my last visit now.
Number 4, authorizing the acceptance of grant funding from the New York State Office for the Aging and agreements with the New York State Office for Aging and the Departments for Aging and Social Services regarding the expanded in-home services for the elderly program.
Good evening, everyone. We are back again this month. We made this presentation last month, and as it got through the process, it was deemed that we needed further backup, so we were told to re-present again. The program is the ISEP program. The backup is now much stronger than what we had. The ISEP program is out there to help people age 60 and older, as I think we all know, to age in their home, to keep them there, to delay them being put into nursing homes and assisted living.
Any questions, observations?
I'll make a motion.
Can I get a second? Second. All those in favor?
Aye.
Any opposed? Unanimous. All right, authorizing the acceptance of grant funding from the New York State Office for the Aging and agreements with the New York State Office for the Aging and the Departments for Aging and Social Services regarding central assessment unit for the provision of home-delivered meals and adult daycare services.
Yes, and once again, this was the second item from last month where it was deemed that backup wasn't sufficient. We have rectified that situation. This is a program that NYSOFA, it's 100%, that NYSOFA reimburses the Department of Aging through DSS to do the assessments for our recipients of our home-delivered and our adult social model daycare program. This is the same amount as it was in previous years.
52,500?
52,500, yes, sir.
Any questions, observations, comments? Can I get a motion? Unanimous. Moving right along. Authorizing an agreement with the New York State Office for the Aging regarding the Aging Mastery Program and amending the 2016 Department for Aging budget.
Okay, we come before the legislature and the Social Service Committee to allow us to accept this grant and to put it in action and to amend our aging department budget to the tune of $20,000. The Aging Mastery Program is a small program that the State Office of the Aging asked us in Albany County to help them out with. The program is one that's used to help seniors modify their behavior in an incentive-type program to help them age well. The philosophy is that modest lifestyle changes can help a senior, and it's pretty much proven in some of the numbers that I've seen in other areas that it works well. The grant is worth $20,000, and NYSOFA has requested that we become the pass-through, and the Albany Jewish Community Center and Senior Services of Albany have been chosen by them to implement the AMP program. Yes, sir.
Victoria?
Mr. Brown, what kind of lifestyle changes, or like diet and exercise, things like that?
It's a myriad of items that they're going to put, like coaches out to go around and talk to different organizations and different parts of their service for exactly that. Lifestyle changes, diet changes, some activity changes and things. It's not a big, huge thing, but it's a little thing that if you build on it, it will definitely help a senior possibly improve their living situation and maybe hopefully deter them from any future situations like hospitalization and maybe nursing home or assisted living situations. Once again, the Department of Aging wants to keep our seniors in their residencies as much as possible.
Thank you.
Mr. Joyce?
How will the JCC be involved with implementation?
JCC and SSA, they're kind of piggybacking on one another. They wanted two organizations to be involved in it, basically for two ends of the city. The way I understood it, JCC is there, the NORC is there, and there would be a good correlation for them to work in with the NORC and various organizations to help improve the situation.
Activities will be taking place at the JCC, you would imagine, or?
The trainings may take place there, and then people may go out of there and go into various organizations anywhere in the area.
Okay, is there a schedule when they're supposed to begin, or is that?
They, believe it or not, they have already begun the program. Unfortunately, in typical NYSOFA fashion, it took a while for us to get the information that we need to make the presentations here, which has been a problem. But we were able to have them both start early on, both JCC and Senior Services into the program.
All right, thank you.
Ms. Lockwood.
I'm just a little bit confused. Is this outreach from both of those groups to individual seniors to help them with like activities of daily living and identify things like maybe handrails or things to help them aid in their home?
I don't think it's that strong of a program. I think it's more to do some of the minor things of daily living, like modifying your diet, doing a little exercise program, maybe getting out. It's not like some of our other programs to modify the homes and everything. That's not what this is. We have other programs that we're gonna.
So you would envision people coming to each of these centers to be educated on nutrition or diets or something?
Yes.
Not going into the home?
I don't, at this point, I haven't been told that they're gonna do home visits. It looks to me, it's gonna be more of a group thing, but, that could change down the road.
I know it's not a lot of money for doing either, but,
No, but it's, like I said, it's a program that NYSOFA came to Albany County and they already did the legwork and talked to JCC and Senior Services. We had some help from them and they agreed to do the program. We have to be the pass-through for it.
I picked up on something you said earlier. You had two organizations from both sides of the city.
Well,
I assume that's the city of Albany. But could you tell me how, I remember when we first got together, we talked about how the town of Colony had the most per capita seniors in the entire county. How would seniors who live outside the city, first of all, are they able to participate in this? Are their officers trained? Could there be satellite outreach to Colony Senior Service Centers Incorporated or to the Colony Senior Services Department, or is this
Colony, I'm sorry, but Colony was originally asked to get involved in the program, but they weren't able to handle it based on what they're doing in their organization. They didn't have the staff to do it based on other things that they had. So they kind of, in the beginning got into it, and then when they realized what was entailed with the staff and the way they're structured, they couldn't do it. But this isn't a program, and if I said different parts of the city, I maybe,
that's why I was just
no.
curious whether it's a county program or a city program.
Oh, no, this is a county-wide program that the two agencies were picked by NYSOFA to start the mastery end of it, which is the education end, and then people would branch out from there and go out and do whatever, the program, whatever specific item is, to go everywhere. It's not limited to Albany per se. They could go up in the hill towns. They could, depending on where they're gonna bring their program.
Well, do we have any sense of what kind of outreach they plan to do? Or?
I don't have the exact agenda. I will see if I can reach out, because they left there's a broad spectrum of things that people could do, okay, which we didn't have to limit them. It's something between NYSOFA and the two entities, but I'll see what I can find out and we'll get back to you.
We can find out for you.
That would
Follow up.
be greatly
Yes.
appreciated.
Okay. Any other questions, observations? Can I get a motion? Second? Moved and second. All those in favor?
Aye.
Any opposed? Okay, passes unanimously. Okay, number 7. Authorizing an agreement with the SUNY Albany School of Social Welfare Center for Human Service Research regarding the Juvenile Detention Alternatives Initiative.
Good evening, everyone. The department respectfully requests legislative action to renew a contractual agreement with SUNY Albany their Center for Human Services Research in the amount of $38,279 for the period of April 1st, 2016 to December 31st, 2016, in order to continue to support the juvenile detention alternative initiatives. Albany County is one of 6 counties that has the JDAI as its the abbreviated program, and it's specifically targeting strategies and programs to really address minimizing the number of children that are entering into detention. And so it's really looking at how we can implement programs and services in order to really avert children going into detention if possible. So with the JDI program, we have a coordinator, a part-time coordinator who facilitates that program, as well as we have a contract with SUNY Albany that really facilitates the research portion of that. So in terms of tracking the data, in terms of providing feedback in regards to what the numbers are presenting, and in terms of being able to then determine what strategies we need to take and how we need to continue to progress as we look to really continue to bring down those numbers in terms of the youths entering into detention.
Questions, observations, comments?
We'll make a motion.
Yep. Second. Move to second. All those in favor? Aye. Any opposed? Authorizing an agreement with the, authorizing the submission of a supervision and treatment services for juveniles program transition period application to the New York State Office of Children and Family Services.
Yes, thank you. So the next 2 items, 8 and 9, are interrelated. The Supervision and Treatment Services for Juvenile Program, or the SCSJP, that is a program that funds, again, specific programs related to juvenile justice in regards to having intervention for youth who are interfacing with the juvenile justice system. So they support programs such as family alternative intervention, which is based over at Family Court, which is an assessment that takes place prior to the youth going into court to basically be able to look at what is going on and are there recommendations for how we might be able to serve this child within the community without them having to go into the detention system. It supports programs such as JCAB, the Juvenile Accountability Board, again, looking at other programs and services such as restitution as opposed to placement and detention for youth. And so this funding is usually on an April 1st to March 31st calendar. With the enactment of the 2016-2017 executive budget, it changed that. So now the new period of funding for the SCSJP is going to be October 1st through September 30th. So for those counties that had a previous approved SCSJP contract, it ended as of March 30th. So from the period of April 1st until October 1st, from the period of April 1st to September 30th, counties needed to come up with an interim plan to cover that period of time that the funding is until October 1st when the new funding cycle begins. And so we do have sufficient funds left over between the SCSJP and detention in order to cover that interim period. So that's what this particular request is for, is to be able to cover that interim period from April 1st through September 30th until the new funding cycle of the SCSJP occurs. Did that make sense?
One question. Followed most of it.
Okay.
I count myself lucky. Is this 38% county share a one-time charge, or once we get on a fiscal year, will that continue to be?
That is the reimbursement.
So the fact that this is a step piece to get us on a fiscal year basis doesn't change any of the
No, it doesn't.
percentages for the funding stream?
No, it
Okay,
doesn't.
thank you very much.
Oh, you're welcome.
Mr. Chair.
About how many children are served in this program?
Well, there are, If we're going to look collectively at the number of youth that we are serving through the juvenile justice, I would say probably we're looking at about 100, I would say, in regards to when we break out from our foster care numbers specifically.
What's the age range?
We're
Does it go
looking,
up to 18 or?
yes, it does, and we're looking at primarily, looking at from age 12 in regards to up to 18.
Thank you.
Right, because we also have our PINS program, so usually for the younger youth, a lot of them are served through the Persons in Needs of Supervision program.
Any other questions? Can I get a motion? Second. All those in favor? Aye. Any opposed? Okay. I know you said 9 was interrelated, but we'll.
Right. Sure.
Authorizing an agreement with the New York State Office of Children and Family Services regarding funding and submission of the 2016-2017 Supervision and Treatment Services for Juveniles Program.
Right, so whereas number 8 was for the interim plan, this is actually for the full plan, beginning October 1st and going through September 30th of 2017 for the STS-JP funding. So again, the same program that we just described in 8, but now this is for the time frame of October 1st, 2016 to September 30th, 2017.
I'll make a motion.
Second. All those in favor?
Aye.
Any opposed? Passes. Number 10, authorizing an agreement regarding the Child Fatality Review Team Program and amending the 2016 Department for Children, Youth, and Families budget.
Yes, thank you. So the Child Fatality Review Team is a body of various representatives from various segments of the community that come together, and their sole purpose is to review when there has been a fatality report and to look at the circumstances that occurred in that fatality and to offer recommendations going forward in regards to what might we be able to change, whether it's policies, procedures, systems, integration and collaboration in terms of really being able to, was this something that could have been prevented, or is there anything going forward that within the various systems could be done differently that might have an impact going forward in terms of reducing fatalities. So that is really their purpose, as they come together and they look at fatalities that have occurred and really make recommendations in regards to going forward, what might be some policy or procedural changes.
Do you have like examples of the most recent changes or recommendations?
The rollover one was it?
That's exactly what I was going to say. A lot of our focus has actually been on safe sleep because we see that as a preventable death, if you will, the co-sleeping. So, we've had quite a number of those cases where a child has unfortunately passed away because a parent or caretaker has, made the decision to co-sleep, and, they roll over or the child gets wedged in between the beds. So, that is definitely one of the areas where there's been a lot of focus in terms of awareness, education. We do a safe sleep campaign. We put up, we use the bus shelters, we use buses, billboards. We've done PSAs, again, just to promote, the dangers of co-sleeping. We certainly understand that, there are those that advocate in terms of, sleep bonding and sleeping together, but we really just want to highlight what are the potential dangers of that. And, you never want someone to have to live with that, a decision that they've made resulted in the death of their child. So that's definitely one of the areas we focused on.
And they were able to provide cribs for people that didn't
Yes,
have
we do
adequate
have
bedding,
the-
which is an important part of the program.
Yes, thank you. We have the Cribs for Kids contract, and so we are able to provide a safe sleep area if a family does not have one of their own. So that's one of the ways we've tried to intervene in regards to that.
Any questions, comments, observations? Can I get a motion? Second. All those in favor?
Aye.
Any opposed? All right. And 11, authorizing an agreement with the Trinity Alliance of the Capital Region, Inc., regarding the provision of family and neighborhood resource center services.
Thank you. So the FNRC, as we call it for short, receives funding through the COPS, which is a alternative source of funding provided through Office of Children and Family Services, OCFS. And the distinction in terms of that funding versus prevention funding is specifically for the prevention of placement of children into foster care, or if a child is already in foster care, then how to expedite their return from foster care back to their home of origin or an alternate resource. The COPS funding is before we even get to that level of being at risk of placement. What programs and services can we provide before it even gets to that level of risk? So that is what the Trinity's FNRC program provides. They do in terms of being able to provide if there's need for food resources, if there's a need for linking to housing resources, if there's a need to, they do a tax service on a yearly basis to help folks with that. They'll provide advocacy around employment, around education. So again, it's really the level before a family gets to that level of risk where they're now looking at placement and prevention services. That's providing that space of program and services for families.
Commissioner, I think over the years we talked about, has this expanded to the hills towns yet? Or are we still pretty much just in the city? Because we talked about providing some services to the outlying areas. I didn't know.
Right. Unfortunately, the limitation with this is that the COPS funding had a period of time where the state was providing it, and whoever was funded is limited to just that
jurisdiction.
Exactly.
And that was the city of Albany, obviously.
Yes, and so at this point in time, there is not the availability to expand beyond what was approved at the time that it was approved.
Because I remember hearing, that's not my district, but the need in the hill towns for this.
But, certainly, we try to cover that gap with other services, such as we expanded the St. Catherine's prevention services to cover, so we're doing our best.
Any other questions? Should I get a motion? Second. All those in favor?
Aye.
Any opposed? All right, thank you.
All right, thank you.
Can I have a motion to adjourn?
Take care, Mike.